Hi, I'm Holly Casino, and I'm here to discuss Fragile X syndrome and some of the causes and effects that some of our children have in the world and when we teach children in school. And I have a PowerPoint presentation. Fragile X syndrome. We're going to discuss some important things on the agenda. What is Fragile X syndrome? Some of the causes, the treatments, the statistics, physical effects, behavioral characteristics, and learn more and how you can help. And I'll have some key websites that you can use after this important video. Fragile X syndrome. Fragile X syndrome can also be known as FXS. It is a condition in which the bottom of the X chromosome in the 23rd pair of the chromosomes is pinched off. It is the most common cause of inherited mental impairment. It occurs more often in males than females. You'll see over here, I have the father and the mother and the diagram on the children and how they can get Fragile X syndrome with the X chromosome. This impairment can range from learning disabilities to more severe cognitive or intellectual disabilities. For between 2% and 6% of all children diagnosed with autism, the cause is the Fragile X gene mutation. Approximately 1/3 of all children diagnosed with Fragile X syndrome also have some degree of autism. This impairment can range from learning disabilities to more severe cognitive or intellectual disabilities. Some of the causes. Genetically inherited, it is transmitted from parent to child through DNA. The immediate cause is that a person with Fragile X syndrome does not make a specific protein. By going back further into history to try to understand why Fragile X syndrome develops in certain families or populations, but is less likely to appear in others. Here are some physical effects that you may see with some children that have Fragile X syndrome. They may have a large head, flat ears, a long and narrow face, prominent forehead, a square chin, large testicles, large hands with non-tapering fingers. They may also have a broad nose. I'm going to discuss some behavioral characteristics. The most prevalent historical characteristics of children with Fragile X are attention problems and hyperactivity, known as Attention Deficit Hyperactivity Disorder, also known as ADHD. I believe some of us are very familiar with children that have ADHD. Fragile X in children with ADHD may benefit from the addition in tricycline and antidepressants or a major tranquilizer such as Thorazine. Children with Fragile X have strong reactions to changes in their environment, and their heightened anxiety can compound their behavioral difficulties. Some of the other behaviors associated with Fragile X are similar to those of autism, including hand flapping, hand biting, poor eye contact, and tactical deficiencies. Here are some of the treatments. Fragile X has no cure, unfortunately. Early intervention in the preschool years can help these children make better progress. So the earlier parents, are aware of their children having some of the signs that we just discussed on the previous slideshow, is very important that they are aware of their child's disability and try to get treatment as soon as possible. A child may need speech or language therapy, occupational therapy, or physical therapy. Special education programs. Having a regular routine, avoiding other stimulation, and using calming techniques can help reduce behavior problems. Medications may help treat the aggression and seizures, hyperactivity, and short attention span that can occur along with FXS. And here are some statistics that I discovered doing some research on Fragile X. Fragile X occur in approximately 1 in 1,000 male births and 1 in 2,500 female births. In association with mental retardation, it occurs in 1 in 4,000 males and is less than half as many females. Up to 80% of males with Fragile X syndrome are depicted and congenitally delayed. About 30% of females with full mutation score above 85 on the IQ test, with 70% of them ranging in the borderline or mild range of mental retardation. That pretty much wraps up my PowerPoint presentation on Fragile X syndrome. You'll see here I have some additional information if anybody chooses to research further or may know of a student or family member that has Fragile X syndrome and would like to identify themselves with it a little bit further. I just want to thank you for viewing my website, and I hope you enjoyed everything that I had to say about Fragile X syndrome. Thank you.